Hello, I'm Dr. John Daly, Chief Medical Officer of COLA. Today I'd like to talk about Legionnaires disease. A few months ago, there was an article published in the Journal of the American Medical Association asking the question, why are Legionnaires disease diagnoses becoming more common in the United States? Several interesting areas were explored in answering the question. As background, the species of bacteria, Legionella, is the cause of Legionellosis. Legionella bacteria are in the family of organisms Legionellasiae, which include 48 different species of Legionella. The bacteria were named after an outbreak of pneumonia at an American Legion convention in 1976. Was found to be caused by the newly recognized bacteria. The disease is transmitted to humans when small droplets of water in the air that contain the organism are inhaled, leading to the development of pneumonia. It is very uncommon for the disease to spread from person to person. The organism can be found in freshwater environments like streams and lakes. More importantly, it can contaminate water systems in buildings, whirlpool spas, and cooling towers, and these can serve as a source for infection. Risk factors making one susceptible to infection include heavy smoking, chronic lung disease, the elderly, and the immunosuppressed. Infection is uncommon in children greater than 1 year old unless there is an underlying disease such as malignancy or immunosuppression. The identification of Legionella infection is increasing. In 2000, there were 110 cases reported to the CDC, and by 2016, 6,100 cases were reported. The disease is considered to be greatly diagnosed. So why is the disease increasing? Undoubtedly, one of the reasons is our increased awareness of the disease and the availability of point-of-care testing with a urinary antigen test. However, other reasons include increasing age and poor maintenance of water infrastructure in buildings and cooling towers. In 2015, a group of 131 cases and 16 deaths from Legionnaires disease was found to be caused by a single cooling tower in the South Bronx in New York City. Many similar outbreaks of infection have been reported across the United States. The JAMA article further discussed the underdiagnosis of Legionella infection. Commonly, this occurs because we fail to think of Legionella as an etiologic factor in a patient who is presenting to us and fail to test for the presence of the organism. There are several different methodologies that can be used in the clinical laboratory to diagnose Legionellosis. The urinary antigen test is the preferred initial screen for Legionnaires disease. This test will detect Legionella pneumophila serogroup 1 antigen excreted in the urine. This serogroup is the most common cause of Legionnaires disease. The test does not detect other serogroups or other Legionella species. This test does have a high sensitivity, with some reports indicating 70 to 90% sensitivity and almost 100% specificity. The test may remain positive for several weeks, even after the administration of antibiotic therapy. A second modality of testing is direct fluorescent antibody staining. This is a rapid test that can be performed on respiratory samples and tissues and can be completed in less than 2 hours. This rarely has cross-reactivity with other genera. The sensitivity of this technology ranges from 33 to 70%. Culture is considered the gold standard for diagnosis because it can identify all species and serogroups of the Legionella organism. This, however, is a time-consuming test. It can take 5 or more days and requires specialized microbiological media. Culture of sputum has a sensitivity of approximately 80%, and the use of bronchoalveolar lavage has a sensitivity of 90% or better. Polymerase chain reaction testing can be used to detect Legionella DNA in urine, bronchoalveolar lavage fluid, sputum, and serum samples. However, while this is commercially available, PCR is not widely used today. The sensitivity is generally considered not much greater than culture of the organism in sputum and bronchoalveolar lavage. Thank you very much for your attention.